Hello, everyone, and welcome to the Healthy Mothers, Healthy Babies first coffee and chai chat of the year 2023. It's great to have you here. The chat is being hosted by me, Martin Mwangi, and I am the program lead of the Healthy Mothers and Healthy Babies Consortium, which is hosted by the Micronutrient Forum. Please feel free to introduce yourselves in the chat and mention the name of your organization and country from where you're joining us or where you work. You are also requested to write your name and organization in your Zoom window. And please note that this session will be recorded. All participants will be muted during the presentation, and during the question and answer session, you are welcome to turn on your videos. Please type your questions in the chat or raise your hand to ask questions. And when asked to speak, please unmute yourself and then kindly mute yourself when you are finished speaking. Now, in today's chat, Dr. Clayton Ajello and Mr. Spencer Kirk will discuss the topic entitled Developing a Multiple Micronutrient Supplement Supply Strategy to Meet the Growing Global Demand. And first, I'm going to introduce them, and then I'm going to introduce the topic. And first, with the introduction of Dr. Clayton. I'm pleased to introduce him as our main speaker today. And in his various roles, he's filled over the many years as an epidemiologist, an entrepreneur, and executive with experience in more than 30 countries. Clayton has worked to introduce proven, sustainable, high-impact public health innovations into low and medium resource settings. Now, Clayton's career spans academic and both the nonprofit and for-profit private sectors, having served in the World Bank early in his career, then as vice president for international programs at the Johns Hopkins University and Johns Hopkins Program for International Education in Gynecology and Obstetrics, otherwise known as JPIEGO, as well as on the faculty of the Bloomberg School of Public Health. Subsequently, Clayton took a division of Johns Hopkins University into the private sector, founding a for-profit learning services company. After its successful sale, Clayton returned to his roots in public health and currently is a technical advisor to a number of public health organizations. Now, Mr. Spencer is an entrepreneur, a philanthropist, and the managing director of Kirk Humanitarian. Spencer and his wife, Kristen, founded Kirk Humanitarian in 2002 with a mission of improving maternal health around the world. Kirk Humanitarian is a leading purchaser and owner of high-quality and safe multiple micronutrient supplements for low and middle-income countries, governments, and NGO partners. We are very honored to have our two speakers today. And just a minute. And going forward, I'm going to now ask Clayton to load his slides, and I will start introducing the topic. So Clayton is with us today to talk about a critical intervention for maternal nutrition, multiple micronutrient supplementation. MMS, otherwise known, is a widely researched, proven intervention that improves maternal health and reduces adverse pregnancy outcomes. In recent years, we've seen positive momentum related to MMS on many fronts, from awareness raising, building consensus for MMS introduction, global and regional and national advocacy wins, and an expansion of implementation research. But now we are facing a new challenge. Given the increased interest and demand for this life-changing intervention, this demand is projected to outpace the global supply and manufacturing capacity in the next 2 years. Clayton will provide a brief overview of a new resource paper from Kirk Humanitarian titled UNIMAP MMS for National Health Systems, Considerations for Developing a Supply Strategy. And this paper outlines key next steps for our community to address this alarming gap. Then Spencer Kirk will provide his expert viewpoint on the way forward for our community. And finally, we'll have a 20 to 25 minutes for question and answers, during which I invite you to come off mute to ask any questions you may have. Clayton, over to you.
Thank you, Martin, and welcome and thanks to everyone for joining the session today. As Martin mentioned, I'm the Senior Technical Advisor to Kirk Humanitarian, and we are a US-based foundation that assists national governments with financing for product supplies and technical assistance to introduce MMS. The presentation I'm going to give in a moment is based on a collaboration among Kirk Humanitarian, the Vitamin Angel Alliance, and Pajajaran University in Indonesia. Before I move on, though, I do want to mention and remind everyone that neither Kirk Humanitarian nor the Vitamin Angel Alliance manufactures or sells the UNIMAP product, but both of our organizations purchase MMS and use it solely for donation to eligible partners who are actually introducing MMS. So also for those of you who are just becoming familiar with UNIMAP MMS, it is the United Nations International Multiple Micronutrient Antenatal Preparation. That's the UNIMAP part. It is a specialized formulation of multiple micronutrient supplements generally for pregnant women. It contains 15 essential micronutrients that are shown in the facts panel on the right. And for simplicity, I'm going to refer to this formulation throughout this presentation as just simply MMS. The formulation itself was developed in 1999 for the specific purpose of creating a supplement for pregnant women that could be used in clinical trials. And the clinical trials that have been completed since 1999 have generated an extensive body of evidence to show that MMS improves maternal health and also reduces adverse pregnancy outcomes as compared to iron and folic acid. The safety, the cost effectiveness, and the affordability of MMS have also been thoroughly examined and demonstrated. The evidence that has been accumulated has led to this initial global policy framework that consists of WHO's antenatal care recommendations for a positive pregnancy experience. That's on the left-hand side, and it contains a context-specific recommendation for MMS use. The middle document is UNICEF's interim country-level decision-making guidance for introducing MMS. This provides practical programming guidance that recommends introduction of MMS into antenatal care services, but informed by implementation research. And on the far right is the WHO model list of essential medicines that was updated in 2021 to include UNIMAP MMS. Currently, there are at least 20 countries that are introducing or exploring the introduction of MMS, consistent with this global policy framework on the screen. And we expect that over the next several years, there will be many more countries that will be joining in the opportunity to introduce MMS into their countries. I do want to underscore here that MMS is not a magic bullet, and its introduction should be leveraged to improve antenatal care services generally, but to include the interventions that are recommended by WHO, most of which are found in the document on the left-hand side of your screen. So, excuse me, given the evidence, the global policy, increased awareness and interest, global demand, as Martin indicated, for MMS is growing, and the projected to outpace global supply, as shown here in this figure. There are two ways, at least, to show demand. And if you look at this figure, the light gray bars show total demand by year based on live births. The dark gray or slightly bluish bars show the demand based on total pregnancies. The dark blue line at the bottom that crosses all of the bars shows actual and projected volumes of MMS supplies produced by the existing manufacturers, but assuming a realistic expansion of their manufacturing capacity over the time frame that's shown in the figure. The orange line shows exactly the same thing, but it assumes, in addition, a modest increase in the total numbers of manufacturers who are producing the MMS product. So the current progress to date, or the current progress to introduce MMS through the application of implementation science, which is in fact the recommended approach, shows that we're on a trajectory to reach about 100 million pregnant women annually in low and middle income countries by 2030. Under both of the supply scenarios that are shown in the figure here, the demand for MMS outstrips supplies starting in 2024, but it continues through 2030. And in fact, the supply gap widens as you get closer to 2030. Even under the accelerated supply scenario, which is the orange line, the volume of product produced in 2030 will support only roughly 50% of the 100 million pregnancies that are associated with the projected introduction initiatives that we can foresee at this point. So the bottom line here is that the supply gap will become evident in 2024, and without incremental action beyond what's already planned, by 2030, we'll have sufficient MMS supplies really for less than 25% of the 228 million pregnancies that actually occur right now annually in low and middle income countries. I think that there is probably agreement among all of us that this requires immediate planning and action to resume, because it's an unacceptable situation for future growth of the programs. The urgency to act is driven by a number of key realities, many of which we have discovered as we have been examining country experiences. So the first and foremost and most important reality here is the lead time to production. Manufacturing by a manufacturer producing this product for the first time requires a 3 to 5 year lead time to complete all the steps that are involved in getting to a finished product that's ready for commercial use. Secondly, is there are very few countries that have the technical and industrial capacity to produce MMS. This means that we are going to have to depend on high volume manufacturers to meet future global demand. And of course, many of those manufacturers can and are actually located in low and middle income countries. Right now, there are only 13 manufacturers globally who are able or close to being able to produce MMS for commercial use. Unfortunately, manufacturers will not start product development unless they have a contract in hand. And then finally, adding MMS to a national government's regular procurement mechanism is actually quite complicated, and it's going to be require a significant investment of time and expertise and financing to actually make happen. So recognizing the complicated nature of product supply, Kirk Humanitarian has created this resource document that's on the left-hand side of your screen for stakeholders that are interested in securing MMS supplies. It is informed by the experiences from 8 countries. It begins to identify lessons learned and operational considerations that are important to developing a national strategy, irrespective of whether the national strategy seeks to have supplies from national, regional, and/or global suppliers. And we should be looking at this document as very much a preliminary document, but it is intended to open up a dialogue around the learnings that have occurred to date so that we can get to a consensus supply strategy. So let's look a little bit at the overarching findings that are generated and shown in the report. And as stakeholders introduce or explore the introduction of MMS, they have begun to identify real and perceived supply barriers to introduction. The key questions and issues that have been identified to date fall broadly into 3 categories. The first is availability and accessibility. And the questions that are raised here are how will governments secure availability when product manufacturing is so limited? How to access product supplies, both in the short term and the long term. How access to supplies can be synchronized with various stages of program implementation. This is particularly important because the recommended approach using implementation science is staged, and it requires different levels of product throughout each of those stages. Another broad area is affordability, and this is a question very much focused on whether MMS is affordable as perceived by the government itself, and that would be ministries of health and finance. And what should the product actually cost if it's being produced? And the third area is around the building of manufacturing capacity. And there are a number of questions that are identified here, some of which include, should the product be manufactured locally or should we import it? how to predict whether a manufacturer can actually manufacture a quality product or not and be successful at it. How long does it take to produce a product? How are we going to assure quality? And are there service delivery issues that affect the MMS product, how it is produced for the marketplace? And this last issue is actually quite important because it focuses mainly on the packaging of the product, and there is a lot of implementation research going on right now to examine that very issue. This is not an exhaustive list by any means, but what it does do is it helps to bring into focus some of the supply considerations that are of interest to national, regional, and global actors. For example, the concerns that are facing or represented by national actors are things like what are the procurement options? Countries know that they can purchase this product on the international market, but if they do local manufacturing, there are a range of starting points for local manufacturing. Will the government actually adopt the UNIMAP formulation and policies that are needed to incentivize its adoption? And very importantly, is there a sound business case for manufacturing in the target country? Another area of considerations is for regional actors, and their concerns are whether manufacturers have the capacity to meet just local demand, or do they have excess capacity, and can they actually produce for export? What does that entail? How do they make that happen? Another concern is, will the government accept sole source procurement where local economies of scale dictate? And this, of course, is an issue where some countries have very limited numbers of pregnancies on an annual basis, and there may not be a sufficient amount of production needed to service more than that could be serviced by more than one company. Finally, at a global level, the concerns are, what does the manufacturing landscape look like? Who are the manufacturers in that universe of capable manufacturers? Where will investments have the most impact? How to deliver a standardized and interchangeable product, no matter who produces it and no matter who buys it? And finally, whether potential manufacturers will need some level of technology transfer. So let me finish this this overall introduction by enumerating some of the urgent actions that are needed to accelerate supply that are mentioned in the report. The first is we need to gain consensus on an overall approach for positioning, building, and allocating resources to meet that demand that we've mentioned. Second is to build and implement a specific product supply strategy to expand manufacturing. There is a need to improve coordination of procurement and deployment of donated supplies that already exist to remove the inefficiencies in those processes that are currently impeding introduction. And there is also a need to identify and activate at least two strategies, first of which is to finance incremental purchases of MMS beyond that's already provided by donors. We know there's going to be a need for donated product sometime into the future, and we need to figure out ways of enhancing the financing that already exists. And secondly, there is a need to facilitate access to foreign exchange for MMS procurement that's going to be done regularly by governments. We expect and we know that governments are interested in buying this product. However, whether you are importing the product or whether you are manufacturing it locally, there is a foreign exchange element that needs to be considered and needs to be planned for now. And then finally, there is a need to acknowledge the importance of achieving a common approach to producing this product that will meet quality standards that everyone can buy into. And then we have to take steps to make that quality system actually work. So in closing, I think we need to, as stakeholders, recognize the need to understand the supply landscape, collaborate and partner to generate a consensus on supply issues because they're different from country to country. We need to develop an actionable strategy and plan to assure availability and access to supplies. And most importantly, we need to act now to implement plans to expand existing supplier capacity and to add new qualified manufacturers. For those of you who are interested in reading more about this, there is obviously the resource document itself and other documents that are on our website. You can go to that. It's listed right there on the bottom of the screen. And for those of you who have questions that may need an individualized answer, feel free to email me as needed. Thank you. Look forward to the discussion.
Now, thank you so much. That was very powerful and insightful. And at this stage, I would like to invite Spencer Kirk, the Managing Director of Kirk Humanitarian, to offer brief perspectives about this topic. Spencer, over to you.
Thank you, Martin. Most important, it's a good thing to recognize that we've got momentum, and I'm grateful for Healthy Mothers, Healthy Babies for providing a forum where we can all come together. The fact that more than 300 of you are joining us today shows that there is an interest in UNIMAP MMS, and momentum is growing, it's accelerating, and I'm glad that we all get to have this discussion today. I want to invite you to read the white paper. Dr. Clayton Ajello spent hundreds of hours working on that document. He also included many others to make sure that the opinions were broadly expressed and that the information was correct. The purpose of the paper is to start a discussion. We know that none of us is as smart as all of us, and if we put our heads together, we're going to tackle this challenge and capture the opportunity that's before us. Kirk Humanitarian's been working on UNIMAP MMS for more than 20 years. Over the last 20 years, we've purchased more than 5 billion doses and donated them all at no cost. We've reached more than 30 million women with a high quality product. It's halal certified. It has US pharmacopoeia verification for quality. And we've been able to benchmark that we can produce UNIMAP MMS at cost parity with IFA. Or put in another way, we can purchase and donate UNIMAP MMS at approximately 1 cent per dose. The way forward is very simple. We've got to work together. We cannot work in isolation. Today, Kirk Humanitarian purchases and donates more than 80% of the world's global supply of UNIMAP MMS. Together with a couple of other organizations, Vitamin Angels, UNICEF, and others, we're only reaching 5% of the women who become pregnant every year in low and middle income countries. 5%. So it's imperative that we come together to figure out how to solve this equation. We can do it. We've got 228 million women who become pregnant every year in low and middle income countries that deserve something considerably better than getting nothing for their pregnancy, or IFA, which at more than 5 decades in age needs to be retired because we have a more effective intervention that's affordable and it's safe. It's time to retire IFA and move into the world of UNIMAP MMS so that we can preserve and protect the health of mothers who become the host for another human being, and also ensure the very best outcome to the pregnancy. This is what we are trying to do with this white paper, is to take the lessons learned over the last 20 years and invite everyone to join the dialogue. And it's a pleasure to join with you today. Thank you.
Thank you, Spencer. Again, always wonderful listening to you, and the figures that you put out in your speech are always mind-boggling, and I think all the over 350 subscribed people today are having the same questions that you have. But let me not preempt. At this stage, we would like now to begin our question and answer session, and you are welcome, all of us, to turn on our videos, and I invite you to add questions to the chat and use the raised hand feature of Zoom to raise your hand, or come off mute and ask your question to either of the speakers. And when asking questions, kindly introduce yourself briefly, very briefly, and mute yourself when you finish asking the question. So maybe as we get more questions asked, and because I can see a couple of hands up, maybe I kickstart with my own question. And this is to Clayton. What do you mean by a global product standard?
Yeah, thanks. Thanks, Martin. It's a good question. The standards that I think we're all beginning to land on really have to do with a few central points that Spencer has actually just mentioned. One is we need to be looking at the default use of the Unimap formula. This is the formula. There are many MMS products that are out on the market. None of them are proven or demonstrated to be effective except for the Unimap formula, so we need to converge on that. We need to also converge on, as another standard, the GMP and pharmacopoeia standards from USP or a recognized pharmacopoeia standard, so that we can have an interchangeable product from manufacturer to manufacturer. We believe that halal certification is very important. We believe at this point there are 180 tablets recommended per pregnancy. We need to ensure that that is part of the global standard, and it's stated as such. There is a need from our perspective, if you are an exporter of the product, you need to have a 30-month shelf life for it to be used globally. And we also think it's very important to hold manufacturers' feet to the fire for them to make a commitment to produce this product at what everyone agrees now is a product that should be less than 2 cents per tablet. UNICEF agrees with that. We agree with that. We think that the product can actually be closer to the 1 cent per tablet range, but certainly within 1 to 2 cents. So that's sort of the global standards that I think we're referring to here.
Thank you. That answers it. I recognize the hands of Olubunmi and Amir, but just before I come to you in that order. I want to ask one question to Spencer, and that's about the benchmark price. Please explain to us why the benchmark price for MMS matters.
Affordability is the short answer, Martin. So as a businessman, I've spent 20 years purchasing those 5 billion doses of MMS. And working with manufacturers, I've asked a question hundreds of times. What does it take to produce MMS at cost parity with IFA? And we have tried to squeeze costs out wherever we could over this 20-year journey so that we could get to a benchmark price of 1 cent per dose. Now, how do I know that we've been able to achieve that? In 2022, we produced 1.8 billion doses. That's enough product for 10 million women. And I can tell you at that volume, plus some serious negotiation, achieving price parity with IFA is something that can be done, which is why we call it a benchmark. Now, we recognize in many places there might be local production, volumes might be less, but the range should be between 1 and 2 cents for this product. But we wanted to benchmark that based on quality, based on halal certification, Zone 4B climatic conditions with the 30-month expiration. We have pursued this quest to demonstrate cost parity with IFA to show the world that this is an affordable intervention, because once the ministries of health migrate from saying, yes, we want to have MMS as part of our antenatal care policy, the Minister of Finance is going to have to pay for this product. If it's not affordable, it's not going to be adopted. And affordability is a key theme that you will hear through this webinar today, that we want this product to be affordable for all women worldwide, regardless of where they live, because every woman deserves something better than IFA.
Every woman deserves something better. Perfectly put. Ayedun, could you kindly put on your video and unmute yourself and ask your question? And then you will be followed closely by Amir, Ali Samnani, and then Uduak Friday. If you are ready, you can go.
Hello, can you hear me, please?
Yes. Yes.
Okay, good afternoon from Nigeria. I just want to say a very, very big thank you for the presenter for their insights on the impact of our MMX. I'll call it our MMX because we are all partners in this. I want to say a very big thank you. And honestly speaking, if I did not say thank you for the effort the Vitamin Angels organization is doing, their support for Nigeria, then we as a country will be an ingrate. So I just want to say thank you again and again. Having said that, I want to plead because I know Nigeria as a country, we have all it takes. We have the company, we have the expert. So if there's, I want to recommend a discussion between the federal government, NAFDAC, and all the pharmaceutical company, or the major pharmaceutical company in Nigeria, because we have the population, we have the need, because our maternal mortality is still at the very high rate. Our neonatal mortality is still very high rate. So we need this micronutrient. So I'm really, really pleading that there should be a start-off discussion to ensure that Nigeria is one of the countries that we start from this discussion to produce MMS. I think that is the way forward for me. And secondly, I'm also going to recommend that MMS should also be given for those women who are planning pregnancy because of the organogenesis. This is my submission. And again, I say thank you. Over to you, please.
Thank you very much. That's well taken. The recommendations are well taken. Maybe Clayton, you can, in your speech later, you can reflect on the organogenesis part and the women who are pre-pregnancy. I know all your work has been on pregnancy, so I don't know whether you, in your exploratory work, looked into that.
A couple of quick. Would you like
I wanted to take the next two questions so that we condense everything, and keep it because of the time factor.
Yep, go ahead.
If you bear with me. Amir, keep your question short and brief, please. And recommendations, well, comments, we can take them in the chat, please.
Okay, so hello from United Kingdom, and many thanks to both the speakers for such a nice delivery. My question is, what is the criteria and procedure for donations to the country? Like, was there any criteria or any set threshold regarding the burden of micronutrient, or what else are the criteria? Like, if we look at the developing countries context, it's very costly, not only the cost of supply, but also if you see the cost of training, capacity building, development for the staff, all the job aids and all the implementation related procedures, these are equally costly. So what is the criteria? This is my specific question. Thank you.
Thank you. And thank you for keeping it short. Uduak, kindly keep your question very short, very brief.
Good afternoon, everyone. Good evening, everyone. My name is Uduak Friday, and I work for Health for All Initiative in Nigeria. My question is, or before I ask my question, I want to thank Vitamin Angels for being every time donating these micronutrients to Nigeria. We are so grateful. In fact, time would not permit to give you testimonies from people in our country who have taken this micronutrient and they have seen the need, the good of it. I want to thank you so much. Thank you, and God bless you. And my question is this: in Rivers State, since 2019, we have not gotten any micronutrients. We've not gotten vitamin A. We have not gotten multivitamin and even the albendazoles since 2019. And we've been getting in touch with our program coordinator from Abuja, Dr. Abiola, and she has not given us any information. She just told us to wait, though we had some challenges in Rivers State. The challenges that we're having is that the Primary Healthcare Management Board, they are asking us to work together with them to be reporting to them. And then their head of department is saying that they have to write a letter, they have to write a letter to them for approval, that they can now be working with us as NGO in the states. And this has been even holding all the states. So I don't know whether it happened like that in other countries. For now, since 2018, 19, we have not gotten these commodities from Rivers State. So I want to ask, what is the reason?
Okay, thank you very much. I'm sure when Clayton is responding, he will reflect on that, also opinion experiences from other countries. I want to add just 2 questions, and then I'll give it to the speakers to respond. One question which is coming through the chat is, has there been any research to show how MMS will adequately provide necessary protection for pregnant women with underlying conditions that may require higher doses of folic acid? And that is a question by Jibrailu. And Ernest, if you can put on your video and ask your question, then I'll cut there, and then I'll take a next series of questions later.
Yeah, thank you very much, Martin, for recognizing me. I think the question that I wanted to ask, it was about the issue about infection, because most of the time this micronutrient supplementation, they also have an interaction with the infection, more especially in our region where the infection rate of malaria is very high. So I'm speaking from Malawi. I also wanted to find out from you, because I think Space has really highlighted that we really need to get rid of the IFA. But I wanted to find out in terms of the cost of MMS, because in countries like Malawi, where we are the people there, they are very poor, the government is very poor, it reached a time whereby even the cheaper, the ferrous sulfate, the IFA, they are no longer in supply. So how sure are we that when we are scaling up the MMS, we are going to have them in stock? Thank you.
Thank you, Ernest. That's a very good question. We go to Clayton first, and then Spencer, and then we take a next round of questions. Clayton, over to you.
Okay, so a lot of good questions here. Let me try to respond to the ones that I can. First, with regard to Nigeria, a very good point. Nigeria is clearly one of the countries where manufacturing should be done, and it is a country that probably could export the product as well to not just meet local needs. So we are very much aligned to the questioner that there should probably be production in Nigeria. The question about preconception, should it be used? This is actually a question. I'm a member of a group called the MMS TAG. It's a technical advisory group that was formed originally by the Gates Foundation and was hosted at the New York Academy of Sciences. That group actually has tried to promote the idea of beginning to look at the data and review data that might allow or suggest that MMS would be usable and effective at a preconception level. There is actually a study that is being discussed right now in Indonesia about doing exactly that, but there are no real firm data at this point that we can cite that would allow this to be made a global policy at this point. In terms of the second question I heard, or the next question I heard, was the criteria for donations. You really have to contact Vitamin Angels directly for that. They have their website. They've got criteria. I think the criteria are fairly general, though. But I think most importantly is if a country is either exploring the use of MMS and there are clinicians that want to get access to product for getting clinical experience, who then may become champions of it. That is one level. The second level of sort of interest from Vitamin Angels' part is around governments that actually have expressed an interest in beginning to explore the integration of MMS into their national health services. The next question that I had here was, there was a question about the interaction between infection and nutrition, and can MMS have an effect? This is a little bit more difficult to answer, probably beyond the scope of this presentation. However, there is a well-defined and well-known interaction between infection and nutrition. Children who are suffering from an infectious disease are predisposed to malnutrition, and children who are malnourished are predisposed to infection. That's well documented. to the extent that MMS can improve maternal health and make it possible for the fetus to be better nourished, you are helping to reduce the risk of undernutrition that can then lead to infections. The next thing that I had specifically about Malawi, those of you who are in Malawi should realize that there is actually a project ongoing right now in Malawi to examine and explore the introduction of MMS. You'll probably, if you are local there to Malawi, you'll probably be hearing more about that over coming months. If you would like more specific information on that or want to be put in contact with the people that are doing that, send me an email and we'll make that happen. I think that covered most of the questions there, Martin, if I'm correct.
Yes, yes, it does. And Spencer, over to you.
What I would like to suggest is I think Clayton answered the questions exceptionally well. Let's go on to the next round of questions in the interest of time, and then perhaps at the end I can just take 2 minutes and summarize a few key takeaways.
Right, that's noted. And just recognizing the question about folic acid, we have in the attendance a member of the from the MMS Technical Advisory Group, Philomena Gomez, who has put a comment in the chat. I request you to read it. I think she says she's not aware of any research answering that question specifically at this point, but it is reasonable to provide the high-dose folic acid supplementation paired with the standard MMS. Taking the next question and recognizing that we are quickly running out of time as normally happens in these kind of meetings, Olabisi Omolona, could you kindly put on your video and unmute yourself and ask a very brief question? And then I'll take 2 or 3 questions from the chat section after you speak.
Hello, everyone. My name is Olabisi Omolona once again. I'm from Restoration of the Dignity of Womanhood, partner of Vitamin Angels in Ondo State. I just want to seize this opportunity to appreciate Vitamin Angels for the regular donation of micronutrients in Ondo State for the past years. And these have reduced mortality rates among our women. So we really appreciate them because the micronutrients, we used to take it to the hard-to-reach areas in Ondo State. And we are in partnership with the primary healthcare board in Ondo State, and they really agree with what I do and they support us in every form. So I want to appreciate Vitamin Angels, and we want the donation, the supply to increase and continue in Ondo State. Thank you very much.
Thank you, Olabisi. I think that was a comment, not necessarily not a specific question. Hawaja Masood Ahmed asks a question from Pakistan, and he says that he's taking further the recommendation of the use of MMS for preconception ladies. What is the role or recommendation for the use of MMS for adolescent girls instead of, I suppose it's iron folic acid supplementation? And whether it should be once a week or twice a week to give 60 milligrams of iron. Maybe Clayton, you can respond to that?
I didn't quite get all of that. Was that for MMS or for iron and folic acid?
That is for MMS, but specifically for adolescent girls.
Yes, okay. So the issue for adolescent girls, there is no recommendation at this point for using MMS with adolescent girls. It's a good question, though, because from an intuitive standpoint, MMS should probably be being used by all women of reproductive age. And if a woman is of reproductive age, this is probably a good thing to do. But right now, there are no global recommendations for the use of MMS with adolescent girls. But I would say stay tuned, and that may be happening, or that certainly will be a discussion over the next couple of years.
Thank you, Clayton. And there are a lot of other input or additional comments being added, for example, by Saskia Ostendap and others. I recommend that we all try and read some of the responses to specific questions. We may not be able to read all of them in the interest of time. We planned this for 45 minutes, and therefore we come in very quickly at the top of the hour, our planned hour. I want to invite Spencer to give some closing remarks, and then I will come on and try to give some closing remarks as well. Spencer, over to you.
Thank you, Martin. Most important thing that I can say is I would encourage everybody to read the document that Dr. Clayton Ajello produced. I approached Clayton 5 years ago because of his expertise in global health and said, help us plan the way forward so the world can transition from IFA to UNIMAP MMS. And as a world expert in global interventions and specifically MMS, I think the learnings that Clayton has aggregated and published are important for us to all get on the same page, so to speak, so we can have the dialogue to figure out together what the best way forward is. So thank you, Clayton, for producing a document that was sorely needed and is important for us to collectively come together to identify what the key issues are. The second thing I would like to say is, having purchased 10 million bottles of UNIMAP MMS in 2022, Kirk Humanitarian is committed to helping qualified NGOs and governments figure out how to transition from IFA to MMS. There's awareness, there's implementation science, and there's scaling. And without a reliable, high-quality product readily available, we're not going to be able to do the research or understand what the needs of countries are. And we want to just simply say there is product available to help governments, because at the end of the day, this should not rely on donations. MMS should not just come from donors. It should come because governments have made this the standard of care for the pregnant women over which they have responsibility. It resides at the national level. So thank you, everybody, for your interest. We look forward to working with you. And thank you, Martin.
Thank you, Spencer. Now, Clayton, you gave us your takeaways. I wonder whether after this chat, you have an additional one sentence, very brief for the audience.
Well, first, thanks, Spencer, for your kind words, but I do want to mention that this document was produced by dozens of people. I was actually more of an editor than an originator of much of this document. So thank you to everyone around the world that actually participated in helping to gather the information. I would also just quickly mention, Martin, that the key takeaways here are very important. They were on the last slide of the presentation, and there is a serious issue with product supply. It needs to be considered as introduction is beginning to be explored, not after introduction has already been decided to be made. And we just need to look at the issues as we're looking at all of the other introduction issues. So thanks.
Now, thank you very much, Clayton. Ladies and gentlemen, as always happens, we never have enough time to answer all the questions, but if you put them in the chat, we can answer them to you directly and respond to you by email if need be, or direct the questions to the speakers if they're directed to them, and then you will get an answer. At the beginning of this webinar, Clayton told us a number of critical realities, and he said that new countries looking at manufacturing MMS will need a 3 to 5 years lead time, and that it's not all countries that will be able to manufacture, because you have to consider a lot of technical and industrial capacity in things to be able to produce MMS. Also, significant time, expertise, financing is required to add MMS to your national government's regular procurement mechanism. He went on to tell us that given all that, we will need to understand the MMS supply landscape globally, regionally, and nationally at your country level. We need to collaborate and partner to generate consensus as far as supply and the strategy around supply is concerned. We'll need to develop an actionable strategy and plan that assures that we have short-term and long-term availability of MMS and access to MMS supplies. And we need to act now. I think that's where he stopped with his key takeaways. And then Spencer came on board and told us, none of us is smarter than all of us combined. I think that was very impactful, because I think if we put all our heads together, we can be able to deliver UNIMAP MMS, and we can be able to produce it at cost, because he has shown us that they have been able to achieve cost parity similar to iron and folic acid. We got to work together. That's something we heard from Spencer. We cannot work in isolation. And he closed by saying only 5% of pregnant women in low and middle income countries are being reached by current initiatives. The question is, what about the others? And I think all of us being stakeholders in this scene, we have to go home with that question. I want to stop it there and thank our presenters today for such a really impactful and insightful presentation. I want to invite you to read the paper by Clayton, and which is in the chat. Our team has posted the link to where you can find it. Please join us for future coffee and chai chats by registering us on the links that have been provided in the chat. And you can be able to view the recordings of this chat and previous chats also via the links that have been provided. And if you follow us on Twitter and other social media platforms, including LinkedIn, you will be able to get informed whenever we are having these sessions. So thank you everyone for such an excellent session. Until next time, this is where we stop. Thank you.